Hello, beautiful people, and welcome to BipolarLines, the podcast where two spouses talk about navigating life, loving someone with bipolar disorder. I'm Brooke.
And I'm Laura, and today we're wanting to talk today about medications and counter-indications of medicine and kind of everything in between. I feel like a common question I always get asked is, what meds is he on? And my answer is the question should not be, what medications is he on? It should be, what medications work best for you as an individual? Because it's so complicated, right, Brooke?
It's super complicated. And just full disclaimer, obviously, if you're a listener, you know, we're not doctors. So we're not going to talk about the ins and outs of medications and what your person should be prescribed. That's not what this is about. And we're never going to talk about it like that because, again, we're not doctors. So let's just put that out there. But yeah, it's a complicated process. And I think we've referred to it in the past as like your medication soup, because sometimes you need different ingredients in order for that soup to be just right. So because there can be a medication soup, there can be side effects and counterindications that nobody was expecting. And this isn't to scare anybody away from moving towards medication and medication management. I am 100% on board with medication management. Too. In fact, as you all may know, that's a deal breaker for me. If my husband does not take his meds, that is a deal breaker.
That is a deal breaker for me as well. Brooke, will you remind everyone what a deal breaker means in our world?
Yes. In our world, what a deal breaker means is if, you know, medication is just one. But if my husband chooses to stop using and taking his medication, taking his medication consistently after multiple conversations and he just chooses not to, then like I can no longer choose to stay in my marriage with him. It is not conducive for us to maintain that relationship. It just isn't.
Yeah, and same with me. Yep. So that's one of a few other deal breakers I have, but certainly he always needs to be at least attempting to be active in treatment, and that includes medication. And there are things that happen when he's manic. He forgets, he loses track of time. I'm not talking about that.
Right.
I'm talking about a conscious choice where he is like, nope, I'm done. I don't do meds. Like, that's going to be a deal breaker for me.
Yes, that's a great way to put it. Nope, I'm done. I'm no longer going to take any medications. Unfortunately, the response from me is, well, then we have to be done because I've experienced living and loving you without medications to manage bipolar disorder. I won't do it again.
Yeah.
So that may feel a little rude, rough, a hard line, but it is, it is what it is. And that's what it has to be. And he's agreed to those, those deal breakers. Stable Jeremy knows that like medication is helpful to him.
Mm-hmm.
Again, stable Jeremy knows medication is helpful to him. Manic Jeremy, yeah, right. Depressed Jeremy, we'll see. Depends on the day, right? Also, for all of our YouTube watchers, I have a new camera, so you can see me. It's not as grainy, but also I got to get used to looking up. So if you see me looking a little crazy, that's what's happening. I'm just trying to get used to this.
Actually, when you look up, it looks like you're looking up. When you look there,
so if I just look here,
it looks like you're looking at me. That looks like you're looking at me.
Okay, cool. Good to know. Okay. So I'll just look straight ahead. Okay, cool.
I would look straight ahead. It looks more natural.
Whatever works, right? Whatever works.
So, all right, Brooke, when did you first realize that Jeremy was going to need to be medicated forever? Oh. I mean, that's a heavy statement. I know I just kind of dropped a bomb. Like, when did you both know? I mean, it's a journey. It was a journey for us too. So this didn't just overnight, I all of a sudden had a boundary and I all of a sudden knew what my deal breaker was. Like, no. This was a gradual process that led me to where I am now. I'm assuming it was for you as well.
Yeah. The difference is, he went almost 10 years being undiagnosed. So we lived that roller coaster for a long time. Mm-hmm. So it started with him taking antidepressants. That's where this whole thing started. And then he was diagnosed. So he was already taking antidepressants when he was diagnosed. So the move from let's add mood stabilizers to the list was fairly easy. And I was all for it because, again, we lived the life, the chaos, the roller coaster shitstorm for almost 10 years unmedicated. And we were looking for anything and everything to help manage the illness and understand it at the same time.
What convinced him to finally decide to even trial depression medication? Because I know a lot of people are very resistant to trying medication for various reasons.
Great question. It was me. I basically said, like, you need to get help or I'm done.
Mm-hmm.
I don't know what help you need, but you need to be evaluated and you need help because this is not working for me. And so then he went to the doctor, and that's when he started on Lexapro. I gave him basically either you do this or I'm out. And so he went.
If I could just take a side spin right here on that, is a lot of people view boundaries, which is what you just set, as a manipulation tool to get them to do what you want. So I just feel like it's value to talk about the difference, because there is a difference. There is a difference in just trying to manipulate someone into doing what you want, as opposed to a boundary that might work. You know, the result might be the same. They might actually comply and do what you think is the best scenario, but they come from a very different intention point.
Yes. Yes, indeed. Yeah. You know, boundaries, like we've talked about, there's a whole episode. I can't even remember the number. I can
I'd
tell
have
you
to look it up too.
Yeah. Okay. The Power of Boundaries is season 1, episode 3. So there's a whole entire episode about boundaries. Go back, listen to that. It'll help you get up to speed as to what we're talking about, and we'll give you examples as to what our boundaries are and what we've had, you know, happen in the past. But yeah, those boundaries exist in order to maintain that relationship and keep us willingly in the relationship, keep the person creating the boundary safe and willing to maintain that relationship, right? And that's basically what I said. Like, if you don't go to the doctor and you don't get help, like I'm done. I can't keep doing this. And that's where we were. So what about you?
Mine was a little bit different. Cody was like undiagnosed for a shorter time than what you guys went through. And then he had just a major manic psychotic episode 9 months after we were married. And it was so severe that like, there was no, there wasn't this like call the cops and he wasn't sick enough type thing that we go through a lot in manic episodes. I mean, it was so significant. It just landed him in the hospital right away on a mental health hold. And so because of the sheer like severity and shock nature of it, you know, he was in the ER and then he got transferred to an outpatient facility and then he was diagnosed and then he was medicated and he had to have like serious meds at first just to, I think it was like Haldol, just to almost floor him. And then once he got there, they could put him on medications. And then we kind of realized what happened. And he said that had that not have been the situation, had he not have experienced his kind of first he was probably having many episodes, but had it not been that severe to start with, he's not sure he would have agreed to medications, where the evidence was just so overflowing. There was just so much of it that he knew he had to stay on.
Yeah.
So I think it scared him not to take the medication, like to have something like that happened again. So that's kind of like where we were at. And then he went 10 years in, you know, what you could consider remission, where he was on medication, but we had no episodes, depressive or manic. And after 10 years, he decided to go off his medication. Well, his psychiatrist retired and he just decided not to get a new one. And it's hard to get a psychiatrist. It's not a matter. I wish it was easier. But so
and not just a new one, but one that you like.
Yeah,
like
that
one
too.
That you actually appreciate and agree with and believe in their treatment approach, right? It's not just like, oh great, I got one, but also like, this is great, but also I don't like the approach. I don't like the tone. I feel judged. I don't feel heard. Yeah. So it's a whole process for sure.
Yeah. Cody feels like psychiatrists are very condescending. And so if he detects an ounce of condescending tone, he's out.
Yeah. I get
it. But so, yeah, he had not found a new psychiatrist and then just decided, look, I've been good for 10 years. I have only had one in my whole life. Like, I'm probably fine. And I do remember him telling me 4 months after he started just kind of weaning himself is what he called it, which I do not recommend. Let me insert there. Lots of bad things can happen. And I'm not a doctor, but lots of negative things can happen if you just try to wean yourself or take you off meds. So definitely putting that in. But that's what he did. And I remember him telling me, and he's like, it's okay. Like, it's going to be okay. And I just remember thinking, like, I have to respect it right now because it has been 10 years and any human would feel the same way I felt like in my heart. Like, if you're on a medication for 10 years and have had no symptoms, what human, regardless of whether it's for bipolar or not, isn't going to be like, you know what, maybe I don't really need those. Like, maybe it was a fluke.
Sure.
But after it wasn't a fluke, and then he spiraled into 8 episodes or 9 episodes since 2016 after that. Yeah, like he's always on medication. That was the only time that he actively did not take it. So that's a question I always get is like, isn't he on meds? Isn't he on meds? Yeah, he's on meds, and breakthrough episodes happen on meds. So that isn't even the end all be all.
Yeah. I think we need to just take a minute to restate that. Like, medication isn't the magic pill. It isn't. It is going to help reduce the frequency of episodes. It is going to reduce the amount of time in these episodes. But it is not going to stop episodes. It's not going to do that. So go into this medication journey knowing that. Please know that. And also, it takes your body time to process medications and different times to process medication. Like SSRIs, those have a shorter shelf life. So your body's going to metabolize those a little bit quicker. Mood stabilizers, that's a whole nother ballgame. That's different parts of the body that's taking in these mood stabilizers and what they're made out of. So it takes them longer to get into your system to even realize if they're effective for the person. So it is a process. It is not a magic pill by any stretch of the imagination.
Yeah, exactly. So, that's kind of where we got to that. And then once he had that episode, the episode after he stopped meds, then that became a deal breaker for me as well. Like, you can never do that again, or I can't stay. Like,
it doesn't work.
Yeah.
It doesn't work. And I think there's a lot to be said for if you and your person, if you're on this journey right now, we've seen some in the Facebook group where like your person is not medicated. Maybe they're refusing meds, but they've never attempted or tried meds, or maybe they've tried one medication and it didn't go well. And their response is, I'm never taking meds for this again. Like, we can understand, we can empathize, and we can have grace for them. And we're not the ones going through it. They are. So like, that has to be hard. That's hard on the body. That's hard to process mentally. It causes more fog, what have you. But also, there are other ways to help promote the right medication soup, like we've talked about. And it doesn't require anything but a cheek swab. Like it's called GeneSight. They do a cheek swab, they run it off, send it to the lab, and it comes back with all the medications that would work for you or wouldn't work for you or are high risk based on a specific diagnosis, right? So it's a genetically engineered test to tell you, here's the list of meds that you should start with, right?
Have you or anyone you've known done that? Because I know people have brought it up to me on my TikTok.
Yep. Actually, my youngest, Addie, they did it for her when we were looking for my youngest. That's my oldest child. My firstborn.
It's late. It's very late for Brooke, people.
It's late for me. We did it for her, and it was specifically for anxiety. And I will tell you, her list was very short on the ones that could work for you. And it was 4 medications I'd never heard before for anxiety. And she's 20, so this is when she was 16, 17. So it was, not that long ago. Yeah. And all, like the Lexapro, the Zoloft, all of those were either in the middle column, which was like, could work, but will have a lot of side effects. And then I remember there being 12 medications on the far right, which was like serious allergies, like could cause you to go to the ER sort of situation. And I was like,
wow,
it's it's interesting. But obviously, we're going to start here with these 4.
Yeah.
And that's what we did. So that was a really, really great place to start because she'd seen what her dad had gone through with meds, right? And how long it takes to like find meds that work for you. She didn't have to go through that. We went through 2.
Yeah.
That's all we did. Yeah. So I highly recommend it. I think it does take some time off of the medication journey and finding what works for you. Oh, side note, just make sure that your doctor's office sends in a prior authorization for that test before they do it. And make sure they pay for it.
Yes, good point. I feel like too, the medication that you might have coming out of the hospital is different than your maintenance med. And, it's really important to just keep a relationship with your psychiatrist. So that was one of the things Cody didn't do initially is he came out of the hospital with these, he was on heavy duty Depakote and Risperdal, so an antipsychotic and a mood stabilizer. This was his first episode. And, he was 135 pounds soaking wet when I met him, and he's 5'11". And then, oh my God, I think he went to and then when we got married, he was like 180, and then he went to like 240. And he doesn't mind me telling me his weight. So if anyone is like, oh my God, he's going to be more, he won't be mortified. He's fine with it. But he just gained so much weight is my point. And then he didn't go back to the psychiatrist because he was just so scared. I think shell shock. He just stayed on these meds for 2 years. And at that point he was over medicated. So yes, those meds cause weight gain anyways, which really sucks, which by the way, if I were him, that would have been enough for me to be like, and I don't think I want these meds.
Right. Sure.
It's a serious thing. When people are like, no, it's just because you eat too much. Okay, stop it. I saw it with my own eyes. Like medication can cause weight gain. It's crazy. And so, then he did, finally find a new psychiatrist when he was able to go back to college. And then that person put him on this maintenance meds. It was like carbamazepine forever. Those 10 years, he was just on this very low dose of carbamazepine, which is it's not even a strong mood stabilizer. And he lost weight on it. So that was nice. Like there again, like meds, and he was on that for 10 years, but that maintenance med that what he took before has never, ever worked again. Ever. Because they tried to do it after his second episode and no, it wasn't even,
Didn't work.
Yeah. So, it changes over time. It's important to know it could change over time. It could change depending on what additional diagnoses you may have or not have or things like that.
Absolutely. And just think about it I think about it relative to when I'm in pain. When I'm in pain, I may take 2 Advil. When I'm in a lot of pain, I may take 4 Advil.
Yeah, that's a great analogy.
Or I need to take a leave because this is a different type of pain. It's going to change based on that person's feelings, how they gaining weight, your medication is going to have to change. The dosage might have to change. Your metabolic process as you get older, it slows down. So you're going to have to also, negotiate down different milligram dosages. And the efficacy of drugs over time decreases as your body and your brain gets used to having that medication, right? So our brains are smart, and those neural pathways that are there, that have been there, we'll call neural pathways like cow paths, if you've ever heard of that term. Like every day you get up, you get out of bed, you walk the same path to the bathroom, right? That's like a neural pathway. It is so hard to change that neural pathway without help, right? And medications help change those neural pathways. And over time, they have to be changed again, right? Like we need to go left this time. So yeah, absolutely great point that over time it's absolutely going to change, should change. Maybe not should, but it's going to change likely. So if the episodes are becoming more frequent, or they're lasting even longer, like, okay, we need to go back for a medication checkup. Like, where are we at? How long have we been on this? What's happening, etc.
Yeah.
Also, one thing to keep in mind, if you've been through the ringer with meds, keep a journal. Keep a log, keep it somewhere, all the medications that your person has tried, the dosages, start dates, end dates. Yes, you can get it from a pharmacy, but let's just say you go to multiple pharmacies for whatever reason. You changed insurances or you moved. It might be more difficult to grab that history. So if you just put it in Excel or Word, whatever works for you, a notepad, notes on your phone, doesn't matter. Keep it. And here's an example. My husband was at the psychiatrist and he was looking for, what was it? It might have just been an antidepressant. It might have just been, I don't remember what it was, frankly. Doesn't matter. But the point is, his psychiatrist is going to put him back on a medication he had previously taken that actually induced psychosis for him. Within 4 days, this man was having psychotic symptoms after taking that medication for the first time. I am so glad that he called me when he was there, because this wasn't an appointment that I went to. He was like, hey, have I ever taken insert medication name? And I'm intentionally not saying that name because everybody responds and reacts differently. So I don't want to add fear for no reason. And also I can't remember the name of it off the top of my head. Anyway, he was like, have I taken XYZ? And I was like, yeah. And he was like, oh, okay, cool. Did it work? I was like, no, it did not. Within 4 days, we were at, a local hospital because you were hallucinating and it was bad. And he was like, are you sure? And I was like, do I need to send you a screenshot? Like, I'll take a picture. I have every medication, right? So keep that in mind, because I don't know why his psychiatrist did that, frankly. But the only thing I can think of was that he wasn't the one to initially prescribe that medication. It was probably done at a treatment facility. And he stopped taking it after he left the treatment facility, but then refilled it. It was a whole thing. Anyway, just make sure you are keeping track. If the person's not, which we can't always expect them to keep track of this, because when they don't know they're sick, they don't know they're sick and they're having symptoms. But that's something that I do. And that's also for my mental sanity. We know we don't want to be mom. I'm not his mom. I'm his wife. But like, I'm a part of his care team. Therefore, I'm going to do what I can to make sure his care and treatment are moving in a positive direction. Does that make sense?
Exactly. Well, I think like what's so maddening to me is that I feel like our medical system, at least like in Colorado, in the United States where I'm at, I feel like every doctor is operating in a freaking bubble. It's like, did you think to call a psychiatrist? Like he told you, you get the case history. What's the point in getting a case history if you're not even looking at or communicating with the other doctors that he's under the care of? And this has happened over and over and over again. And it's very frustrating. And I feel like that's the biggest problem, is we're operating in a bubble. And so like, even when he was diagnosed with diabetes, it's like, well, did they check with your psychiatrist? Or I asked them even, like, have you called it? No, we didn't call. Like, they don't even think to call. They looked at me like I was nuts. Like, we don't do psychiatry. We do diabetes. Okay, but, or like, there was this one time he had, he's gotten in numerous snowboarding accidents, this man. Oh my God. And I think, don't quote me on this, but I'm pretty sure they prescribed him a steroid. It was something to help like the pain. And luckily I was friends with a psychiatrist at the time, not his psychiatrist. She's a psychiatrist for the VA in our city. And all of a sudden, like, he just went like irritable, like dysphoric, irritability. And he's not like that normally. He's not like that. And so after like day 3 or day 4, I'm just like, holy crap. Like, I think he's going manic. Like, and it was, the decompensation was so fast. It's just like, normally I see a buildup. I'm like, oh, he's not sleeping. Oh, we're irritable here. We're irritable. Oh, it was just kind of hit us. And so I remember talking to her, and she started going through that. She was like, has he been prescribed any meds? And what about this? What about this? And she was like, ooh, that can induce mania. And I'm like, are you freaking kidding me? Why wouldn't they have called his psychiatrist? They just operate in a bubble. Oh, I have bipolar disorder. Cool. We only work on your shoulder. So here's the medication for your shoulder. And it launched him into mania. And then luckily that did not require a hospitalization. Once he stopped it, all of his symptoms subsided. Thank God. But like, dude, come on.
Yeah. Yeah, that's terrible. I will say that Jeremy's PCP made it very clear. This is his second or third one in the last couple of years. The last guy retired. But anyway, he like out of the gate grabbed his chart. The first time he met him and was like, okay, so I see your history. Are you still taking these meds, for to manage bipolar disorder, OCD, ADHD, blah, blah, blah. And he's like, yeah. He was like, okay, that's primary. Anything else that may come up that you may need, this has to be primary. Do you agree with me? And he was like,
wow,
yeah.
That's cool.
So that was awesome. Absolutely awesome. In fact, weight gain was like we were talking about. Vraylar is a medication that is known to cause rapid weight gain, and that absolutely happened in my husband. He's been taking it for it's 2025, I don't know, 4 years now. But it was also the medication that actually pushed him into having more periods of stability. So it was like a great medication for him. Jeremy brought it up to his PCP and said, I've got to lose weight. Like, I can't, I've got to. And he was like, okay, so what's more important, being alive or losing weight?
I know.
And Jeremy was like, being alive. He was like, then you have to stay on this medication.
I know.
Let's talk about diet. Let's talk about exercise. Let's talk about, and that's really helpful because I didn't have to say those things.
That is helpful.
He did. The doctor did. So that was fantastic. So find a primary care that'll do that. He was prescribed steroids not that long ago for a hip issue. It was in December. He took it for 3 days. Nothing happened.
That's great.
But right, like that's not to say had he kept taking it, it could have also caused some issues. However, at the same time, he stopped taking his bipolar medication, not intentionally. I had just had surgery. He was trying to manage all my meds and me being like, help me, whatever. So he just forgot. So I don't know if because he stopped taking those meds, that's why nothing happened. Who knows? But that's a scary thought for medication induced mania. And also,
the other one that has caused it was it's like a cold medicine. I know I had some notes down here. What'd you say?
Sudafed.
Yeah, like what is it in Sudafed that's bad though? I forget what it's called.
Yeah.
I can't remember what it is, but it's something, it's like the something in the Sudafed, like Cody just always calls it like speed. I don't know like if that's even accurate, but he's like, I can't have any cold medicines that have speed in them. So I don't know what that means, but or what the active ingredient is in some of those cold medications, but those are no bueno.
%. Jeremy just recently experienced that before Christmas for the first time. No, Thanksgiving.
Oh, here it is. Pseudoephedrine. Pseudoephedrine. Yeah. No bueno.
No bueno ephedrines. Yeah, because that's an upper. That's absolutely an upper.
Yeah. And Cody's more prone to mania, so we can't be putting him anything that that promotes that, including, there was a time his psychiatrist was like, we should really talk about your raging ADHD. And we were both like, he has ADHD? And he was like, you marked yourself clinically significant on every single item on the intake questionnaire. And Cody's like, did I? And he was like, yes, but Cody's bipolar medications do help that. I don't know how and I don't know why, but I know that like he is able to focus. And I think everyone deemed it was just too great a risk since Cody's always at risk of going on the manic side of life. Like maybe we just let him be ADHD. And like
if it's not causing significant, if it's not interfering,
right, exactly. It's not significantly impairing his work or family or like, functioning in life. Yes, I'm sure it's impairing it, but not to a significant point that we were like, okay, maybe it's kind of like, maybe not.
Yeah. Because most medications for ADHD are stimulants, which are uppers, which is going to push towards mania. So yeah, that makes all the sense in the world. I had a thought and it just left me. And it's mood stabilizers. Mood stabilizers. I can't remember the name. Again, it's late here. Sorry, y'all. And it's a Monday. It's been a long day. Mood stabilizers kind of slow down the synapses in your brain.
Okay.
And I think that is probably why it's helping him with focus.
Yeah.
Interesting.
That does make sense because while I met him, while we were dating, he was all unmedicated, unknown that he had bipolar. So I dated him for 3.5 years. We got married. And then after that, so 4 years I knew him before he was ever diagnosed. And yeah, in that time, I mean, he was super smart and he was always given that classic, like, oh, he's so smart if he'd just apply himself. So he was always failing everything. And once he got medicated, let's see, his episode was in 2006, and then he decided to go back to college in 2007. And he was able to get his bachelor degree to become an electrical engineer. And now he's a software developer. Point being, those meds somehow helped him focus enough to quote unquote apply himself and show how smart he actually was. I just say that because like I'm a speech therapist and I have lots of kids with different disabilities, and one being ADHD, and it's just so classic for people who don't understand the disorder to say, oh, they're so smart if they just apply themselves, not realizing that that's the disorder. Like you can be smart and have difficulty focusing. Those two, like Brooke always likes to say, two truths can be true at the same time. And that is exactly it. Yeah.
It really is. Yeah. And, it presents differently in men versus women and girls versus boys. Like it's so frustrating. But yeah, like you all have noticed, I'll go on these ADHD rants where I'm like, I have to get this out. And then I'll say one thing that isn't 100% correct. And I'm like, I lied. That was wrong. In my mind, I am hyper focused on this damn lie. And you're like, it's not even a lie. And I'm like, yes, it is. Yes, it is. It's like this blaring. Bad. But yeah, so mood stabilizers, antidepressants, antipsychotics, right? And I think antipsychotics, that word, that category is spooky.
Oh, yeah.
To so many people. But if you understand what it's there to treat and how it works, it won't be as spooky. And let me give you an example. Not because my brain is not working tonight. Give me an example of an antipsychotic.
Seroquel.
Thank you.
Seroquel.
Yes. Seroquel is prescribed at a non-therapeutic dosage for people suffering from depression. So non-therapeutic for psychotic disorders, right? So we're talking less than for somebody who doesn't have a psychotic disorder or psychotic symptoms. It is prescribed and it works super well for somebody with depression. And it's an antipsychotic. That's just one example. But that terminology, well, this is an antipsychotic. You're like, I'm not psychotic.
Yeah.
That's the stigma behind all these drugs too, right? Like sometimes you just got to put that little label and
yeah, at some point, a lot of times we rebrand things. Like, for example, I don't know why they rebranded, manic depressive. What was bipolar called before?
Manic depressive, yeah.
Yeah. So I don't know why they rebranded to bipolar, but I feel like sometimes they have to do that because the stigma just becomes too, in my mind, it's just too thick. Like that term psychosis at this point, at some point, I wonder if they do just rebrand what that label is, because people think psycho, American Psycho, like, that's just in people's minds now. And so that's a tough word to get over in some people's minds.
And I'm so glad they did rebrand it. And the reasoning, the science is because within the DSM-5, they identified there are two poles, mania and depression, right? And they're like, so it's bipolar. They go from one pole to the other instead of manic depressive, which kind of fed more on the depressive side because that was the ending word. People were like, well, yeah, I'm depressed, so I have that. No, that's not what that is.
Yeah,
So
gotcha. It's
I
so
think
interesting
some
how
are
those
great.
labels change.
Yeah. And I think some are terrible. And I'm like, why would you do that? But, opinions, you know what they are. So, yeah.
I will say, another interesting thing is it makes me wonder. I hadn't heard that you could be on low dose antipsychotics to help depression, but I wonder if it's almost, not I wonder, I'm not a doctor, I'm just musing, because it makes me think of, I had a best friend in high school, like, trigger warning, yeah, this is going to deal with unaliving, so if you don't want to listen to that, you need to stop and come back in 5 minutes. I've known her since I was 14. She was my best friend through high school, known each other in our 20s. In high school, I knew she was very open that she'd been diagnosed with depression. She took medication for depression. Then when we were in our 20s, she just was in a better place mentally. She was doing yoga, she was exercising, she was doing great in school, and she, with her doctor, she was always under the care of a doctor. They both decided, yeah, let's see how it goes a little bit without meds, because it does seem like this lifestyle changes have really helped you and you're in a better spot mentally, yada, yada, yada. Then she had her first kid when we were 26. And she told me, she was like, be really honest if you start seeing symptoms. I'm not going to take any medication while I'm pregnant, but if you do see anything, please let me know, as a trusted friend. And everything was fine. Pregnancy came and went, motherhood came and went. She was a great mom. She doted on this little boy. She was the best. There was nothing. And then she got pregnant again, when her son was, I want to say 5. And this time there was big problems. There was big problems. And she went back to a doctor, but it was a nurse practitioner. Not that I'm saying it should make a difference, but sometimes I do wonder, because hindsight 2020. And the nurse practitioner put her on depressive meds because that's what had been her previous diagnoses. And my friend was completely out of touch with reality. For 2 years, she was listening to spirit radios. She believed they were talking to her. Making her believe anything otherwise was an effort in futility. She truly believed she was psychic talking to dead people. That was period, end of story. And she was still taking her depressive meds, knowing that there was something wrong. But ultimately, it ended up, in her demise. And people who reported seeing it said she was talking to voices. So I don't think it was something she did out of the world would be better off without me type deal. I just, based on what we know of the scene, that was not what was going on. And it does make me think, when they found the medication, her sister was looking, and she was under active care of a nurse practitioner, and she'd been wildly psychotic for 2 years, undeniably, and still kept taking her depression medication. They were in her cabinets. I don't know if our listeners know this, but just taking depression medication alone, if you are bipolar, can lead to mania. And so I just wonder, God, if she was under the care of a psychiatrist, would someone have seen this? Because she was also smart. People are like, oh, it's dangerous to be smart and bipolar. I would argue most bipolar people are freaking smart.
Yeah.
I don't know what the rule is, but most people I know who are bipolar are not even remotely underneath the bell curve. They are extremely smart, so smart that they can mask and get out of, they can fake it long enough to the first responders that show up, to the cops that show up. They know what to say. Cody learns the letter of the law. I mean, he will read manuals and make sure he knows the letter of the law. It's crazy. And she was the same. She was so brilliant. And I'm just like, God, if she was under the care of a psychiatrist, would it have been different? And I don't know. It's water under the bridge. But do you know what I mean? So that's another thing that can happen with
Absolutely. And I'm so sorry, Laura. I know we've talked about that before. That's just a terribly sad situation that also included postpartum depression.
We don't know yet. I mean, we don't really know. She never really disclosed her diagnoses. She did say she went to the hospital once and came out with bipolar diagnosis. She was on a 72-hour hold, but then she denied that ever happened. I have a feeling it did happen. And then, she said it and then was like, oh no, that's not true.
Yeah, I don't like that. I'm taking it back. Yeah.
Yeah.
Sure.
But the fact that all of this happened after the birth of her second child makes me think possibly that postpartum psychosis. I don't really know. I mean, we'll never know.
Yeah,
but I will tell you this, depression meds alone was not going to help postpartum psychosis. It wasn't going to help a bipolar diagnosis. And I don't know why they had continued to just keep prescribing her depression medications 2 years into an active psychotic situation.
But at the same time, we kind of do, because we know that with bipolar disorder, they can mask and they can go in and say what needs to be said, you know? So if that was the case, then we see that and we go, okay, yeah, that makes sense, because the illness can manipulate anyone to get what it wants that doesn't know them.
Mm-hmm. That's so true.
Intimately know them. They don't know their baseline. So it makes sense to me where maybe your friend was exploring the voices and had a curiosity and excitement attached to it, where it wasn't,
100%.
It didn't scare her, right?
Nope,
so it's like,
definitely did not scare her.
I want to know more.
Yeah.
So why would I jeopardize my ability to find out more? You know?
And you're right. I mean, she did know that. I remember being at the ER when she was diagnosed that episode with bipolar disorder, because I stayed with her until I couldn't stay with her anymore. And I remember one of the doctors or nurse practitioners coming in and just doing a generalized questionnaire. And I remember Sarah like smiling and her being like, I know how you want me to answer that question. Or no, she'd be like, I know if I answered that question honestly, you would question my sanity. So I'll give you this answer instead. Like she just could, I was like, oh.
Yeah. And that, my friends, is why I fully, with 100% confidence, with my full chest, I would say anybody with bipolar disorder and that has psychotic tendencies or that psychotic disorder should never be treated without a caregiver present.
I know, seriously.
You really shouldn't. It's so bad.
Yeah, and she did have a caregiver, but unfortunately she had, we haven't talked about this yet, Brooke. We mean to. We will one day, but talk about hypersexuality and affairs and things like that. So she wasn't being the most amazing marriage partner, and so her spouse was pretty pissed and checked out. So that was the only reason I was the one at the hospital with her and not her partner. And I understand why he was in that mental space. I mean,
yeah.
So
I'm so sorry. So very sorry.
Yeah. I mean, it's been a while, and I know that I can, I mean, part of her story is this story, is my story, is why you're up, Brooke, at, oh my God, it's almost 10 o'clock where you are, and me 8 o'clock. Like, we're doing this just because we care, and hopefully our stories can help other people, truly.
Yes, 1000%. Totally agree. The only thing else I think I'm going to add to this medication and counterproductive, not counterintuitive. Medication.
I think you told me before, counterindication, not counterproductive.
Yes. We'll have something. All right, y'all.
Okay, people, we're just wives. All right, we're doing the best we can.
I had it in my head when we started, and then it was like, what did we say we were talking about? Anyway, would be relative to SSRIs. Again, antidepressants, right? So there's a diagnosis called serotonin syndrome risk that is and can be absolutely lethal and deadly, right? So I'm not going to, again, not a doctor, I'm not going to go into all the details, but if your body is producing too much serotonin and you're taking medications like SSRIs and you're not having regular checkups and blood work and things like that, and you start having weird symptoms that have never happened before, pay attention to serotonin syndrome, because it can be really, really bad. So that's one other thing I think I wanted to mention on that front.
Lastly, what I want to mention is that there are side effects, and that if your partner or, loved one is like concerned about medication because of the side effects, I get that a lot. Like on my TikTok, like I don't take meds because of the side effects. That doesn't mean every single medication is going to cause the same side effects in you. And sometimes I'm not trying to even imply that it's easy. Like I only can imagine how difficult it is, and it's your body going through it. But, not to give up. It's worth it to keep going. It's worth it to keep trying to find the right medication cocktail, if you will, Brooke calling it a medication soup. It's worth it to keep going.
Yes.
Different, like the weight gain in Cody, that Risperdal and Depakote, that wasn't his life forever. He was able to get on medication like that carbamazepine, but he was under the active care of a psychiatrist who could monitor his symptoms and make sure that, we weren't going the opposite way and in the wrong direction. Maybe It might be like Jeremy, where it is a matter of, hey, it's either choose this or choose that. And that might be the reality, but like, another thing that Cody had that we haven't mentioned ever, I don't think, is called is it Telekinesis? It's where they twitch. It's like a twitching.
Involuntary muscle spasms.
Yeah. Do you know what it's called offhand?
Yeah, I think you were right. Telekinesis.
Yeah, that's what I think it is. And the only time Cody experienced that was when he had overdosed on a Depakote shot. So they were trying to do like this monthly shot, and then he was supposed to administer it himself. And we only realized later, after both of us were checking the labels, that he had given him 3 times what he was supposed to have given him in 1 month. But then we also just realized, well, that wasn't going to be a viable option because he could make mistakes like that, and that wasn't worth it to then go into this state of like involuntary shaking. So I mean, like, the point is like, don't give up. There's different options. There's shots, there's pills, there's different medications. There's so much that we have now that it's worth it to keep going.
Yes. And if it's a medication that's, you have to, like a shot that you're supposed to do at home, I want you all to know it is the pharmacist's job. Their job is not only to fill that medication, but make sure it is administered safely. So if you go into your pharmacy and you say, hey, I am super scared that I'm going to have a reaction to this medication, that pharmacist is going to say, no problem. This is what we're going to do. You can sit here and you can take that medicine, and I'm going to start a timer, and I'm going to come check on you every 10 minutes, 5 minutes. Here's a bell. If you start feeling something, I want you to press it. Like, that is their job.
That's
so
good
if
to
you're
know.
uncomfortable, take it at the pharmacy.
Yeah.
They are there to help you, and they will have the meds available should something happen. I've suggested that to several people because, you don't want to just go home and take the medication and be at home if you're scared about it. I get that. And you don't want to just do it around a family member if they don't know what to do. I get that. Go to your pharmacy. Talk to the pharmacist. I promise you, they will help you through it. And if you want to go back the next time and do it again, that's what they're there for.
Yeah, that's great to know. I mean, they do always say, like, they give you the directions and then ask, do you have any questions? And like,
yep.
Yeah, that's a great point, Brooke.
Yep. They give flu shots, right? They give all. Exactly. They're trained in that area. It's just not commonly known.
Yeah.
That you can ask them to be there to support you through this first process, right? Also, don't be afraid to request like telehealth appointments with the psychiatrist, the prescribing doctor, after you start medication. You don't have to always go into the office, but if you were having a hard time accepting the help through medication, your psychiatrist needs to understand that. And they also need to meet you halfway. I would like to have a telehealth appointment in 7 days, in 14 days, in whatever that medication efficacy, wow, it's late, efficacy number is the day. I want to have a telehealth appointment. I can't come in. I have to work. I have all these things, but I would just like to touch base and make sure that, like, I'm okay. I need that validation. I need that reassurance. They are going to support you. A good psychiatrist is going to support you. And it could even be the nurse practitioner for the psychiatrist. That's okay. At least you are expressing to them, this is what's going on. These are my side effects. This is what I'm feeling. Am I on the right path? And they can say, absolutely. But one thing I will, and I think we've talked about this before, I will always strongly encourage this. Anytime you start something new, keep a journal.
Yeah, I love that.
Keep a journal.
Well, and even I think, to me, whenever I got that advice, I'm like, Cody's not going to do that. So I would just immediately dismiss it. But there is value in you just doing it too. Just keeping moods like, hey, you went to bed at 10 o'clock ish for the last 7 months, and all of a sudden 12 and 1 seems to be your default, and you're telling me that's normal. We can stick with that narrative, or
what's been happening.
We can look at the data and really think about what's normal.
Right. Yes. And also with medication or procedures, like there's a lot of, we haven't even touched on that. There's a lot of like TMS or ECT, so many things that are available. It is hard to remember day in, day out, like, am I feeling better today? Tomorrow I had the same procedure. Am I feeling any better? I don't know, maybe. But if you're able to look back on multiple days, you can see where things are changing.
Mm-hmm.
Like I woke up and I felt some type of way. And then at noon, I was excessively hungry. Okay. And that's been consistent for 3 days. Okay.
Yeah.
Well, your appetite is increasing. That's what we can see here. Maybe so is your irritation or agitation. That's the trend, right?
Yeah.
But if you just get it hit or miss and you're kind of half in, half out of the conversation, you don't even want to be having the conversation, you're not going to remember everything. And then like your own unreliable narrator, and that's not good for anybody. So just something else to consider. And I know it's like, do this, do that, do all these things, but really all we're saying is like, do whatever makes it the easiest for you, for your family, but also effective, right? Like don't just forget about it, but keep it on your phone. I don't know, something along those lines.
My closing message is medication, in my opinion, but also backed up by research, is a very, very important piece of therapeutic care for someone who has bipolar disorder. And as a spouse to someone who has bipolar 1 disorder with psychotic episodes, it is a non-negotiable and it is a deal breaker. And so I am so happy if other people are able to live naturally with financial means or lifestyle changes. I get all these comments on my TikTok all the time. And if that is you, that's wonderful. But the way I go forward, this is for spouses and this is for support for loved ones who are supporting someone with bipolar disorder. When they ask me, how do you do it? This is one piece of a very big pie, but one piece is you absolutely have to commit to treatment. And part of treatment is on some sort of medication, period. Yep. So that's just where I'm at. So what do you think, Brooke, about that?
Absolutely. It's a non-negotiable. And I think too, just as a reminder to listeners, Laura and I may hold a pretty firm line with any sort of advice or guidance that we can give you relative to medication management. That's what we are going to, I don't want to say push, but also kind of push, because we know it works. We know that it can help. And the more and more somebody resists, the less and less options are available.
All right. Well, I think this was a great episode. It's an important topic.
Absolutely.
Yeah, thank you everyone for joining us for another episode of Bipolar Lines. If you want to find us other places, we are on Facebook. We offer a free support group, Bipolar Lines Pod. Find our podcast across all major platforms, wherever you like receiving your podcast. I think we're on Spotify and Apple. I feel like those are my two. And then YouTube as well, if for some reason you want to watch us be ridiculously tired on a Monday night trying to get this out for you by Wednesday. Don't judge. You can also find me on TikTok or Instagram as the BP Spouse. And you can find you, Brooke, where?
On TikTok at break_the_stigma. And I think that covers it.
Right.
Thank you all so much for being here, for showing up for your person. And as always, we'll see you next time.
See you next time.